Welcome to Psychologist Talks. This is going to be part 4 in the series about narcissism and narcissistic personality disorder. This part 4 is going to be focused on treatment. It follows in the line of key elements, subtypes, development, and again, treatment. Now, I'm a little bit nervous about treatment. You've probably heard my nervousness as I mentioned that treatment is coming down the pike in previous episodes. And the reason for that is, it's already a little bit dicey being a psychologist and putting this stuff out there because it can be confused as disseminating or giving medical advice, which is not what I'm doing. I'm just providing information and things to be curious about, some context. But with treatment, I feel like I have to be especially cautious with this and explicitly state that much like I'm not trying to get people to understand and engage in diagnosis in their personal life. And even if you're a provider, I'm not trying to tell you precisely how to diagnose, but you better darn well believe when we talk about treatment, I am not giving anybody a treatment manual. I'm just trying to give central themes or things to consider in the context of treatment if you're a provider. And even if you're a provider, you need to be responsible and ethical with the type of care that you're delivering, in the sense of if this is super uncomfortable or foreign for you. Our APA ethics manual for psychologists, but I'm sure ethics in other degrees say you need to know how to treat this stuff. And if you don't, educate yourself. And understand even further that education and going to seminars is often just up here. It doesn't give you as much experiential knowledge or experiential know-how. This is where even if you're licensed and you're well past the necessity for supervision, you can hire people in the field. If you don't have, folks who are trusted and can hold to HIPAA compliance to consult with, you can hire folks who engage in personal and professional development or who act as long-term consultants that you keep on retainer. And the idea being is they get to know you personally and thereby can do good work in intersecting how they understand you personally with the type of clinical work that you're doing, which is highly invaluable when we talk about working with personality disorders. They evoke a lot out of you. You're not always your best self, especially if you got multiples on your caseload. So if you're a layperson and you just heard the caution I extended to providers in the field, I hope you can kind of infer from that you need to be triply, quadruply, whatever 5 is of that, careful, because this is not about you diagnosing people in your life. This is not about you treating people in your life. So how can you encounter this particular episode or all these episodes? Well, remember, it's just about informing you. I was going to say information, but informing you. It's information that allows you to feel empowered to notice possibilities in your life, to notice cycles, to notice things that maybe aren't quite working for you, maybe you haven't thought about before. And from that, make decisions in your life accordingly. I cannot dictate those decisions. I cannot dictate what's going on in your life. But if you recognize patterns that are unhealthy for you, or cycles or ways of relating that maybe are problematic, then think about what you want to do with that. I can't dictate that. And if you need help with that, that's where you go to a provider, much like I'm encouraging providers to go to and consult, whether through trainings or fellow providers. So please hear me. This is not guidance. This is not advice to say this is exactly what you need to do. So what are these tenets of treatment I'm going to try to work through? 1, talk about framing. Framing I'm going to have multiple episodes on, diving deeper into, but just a helpful reminder and maybe some context around narcissism and framing. Number 2, transference and countertransference, also not unique to narcissistic personality disorder, but we'll try to apply it. And number 3 is what are you kind of trying to do here? What's the course or trajectory? There is a 4th. This comes from a comment. Dana, I appreciate you commenting and saying, well, could you give us a little bit of insight about what treatment with people who are in these relationships with these people, what would that look like or sound like, or some sort of approximation of what does that treatment look like if someone was to come and see me for that kind of concern, which I will try to oblige. So also, it's late day, so apparently I'm going to have dogs barking, so my apologies for the ambient noise there. So let us start with framing. So the whole purpose of framing is, as the name implies, is you frame a house first before you build it. If the frame isn't solid, it's going to fall apart. Obviously, the foundation matters too. Synonymous in my head. Or think of a frame of a picture, or a painting probably is better. The frame gives you confines, like where does the painting begin and where does it end? What are we expecting here? And that's what we're talking about in this clinical lens. Now, it's applicable everywhere, but we're going to talk about it through the lens of therapy. To quickly breeze through it, I encourage you to look for the episode whenever I can create it and post it. But to briefly breeze through it, what I'm trying to do and establish with people is, one, why are you coming in? Let me understand your need. Number two, what have your experiences been in therapy? Or if you haven't had experiences, let's talk about that and understand what's in your mind's eye here. Like, how do you envision this? Or what's the stereotype of therapy? And from that, I'm supposed to assist, even if you've been in therapy before. And typically how I'm assisting is, well, there's structured, there's unstructured, there's directive, there's exploratory. Here's my approach, my tendencies. How can we collaborate? Not to set a firm, this is how we got to stick to it, but at least get a good start point, and then agree that we will reappraise as we go on, that there is a collaborative nature, which in of itself is a clinical intervention, what I'm doing. Number three, though, is probably the most important to me, and that's like, well, that's all well and good, but what do you and I need to do relationally to make this successful? Especially with me being a more direct and transparent provider, I will offer things very freely. I will not obscure things from you. And if you seem to value that, if not, maybe we part ways, but if you value that and that's something you want to try out, what would we need? And what I'm getting at is essentially trust and vulnerability. How do we navigate that? And within trust and vulnerability is a willingness to move through conflict. Now, the best case scenario, let's start with the worst case. It's kind of reversed in my head. The worst case scenario here is I do it with someone I didn't need to do it with because we were on the same page. We already share values. If I hadn't done anything, we maybe would have done this intervention swimmingly without it. But I can't know that. So worst case scenario, we make explicit something that could have been, inferred or just sort of taken for granted. But heck, we've now verbally talked about it, and it just emphasizes or increases the likelihood that we'll follow through. The best case scenario is I've laid the groundwork for potential conflict to be navigated. And what this says is, one, is I'm asking for you to engage. And if there's any desire to disengage, I want you to challenge that. Meanwhile, can we be honest and direct with one another rather than dancing around the real issue? This is important for a lot of therapeutic work, even irrespective of personality disorder, but it becomes essential with personality disorder because their defenses do not like to be challenged. And so when you start poking and prodding, you better have a frame waiting for you, because if you don't, you'll be scrambling to create it after the fact. Create it proactively, not because it secures it and you never have to address it again, but it gives you a point to which you can return and build off of, rather than like, oh shoot, now I need to start doing this work around how we're relating. Do it on the front end and you're going to do yourself a lot of favors with anybody you're working with. Again, check out other episodes as I create them. It'll speak more in depth about framing. Number two is transference and countertransference. As a quick educational piece here, I'm going to describe it very briefly. The idea with transference is, somebody's a human being. They come in to see us. They have reactions to us, and so they have transference reactions to us. We, despite being providers, are humans too. And so we will have countertransference reactions. In the psychodynamic field and process-oriented fields, what we're trying to do is use the transference for something productive as well as the countertransference. But to do that, we providers need to be really diligent and aware of what our countertransference reactions are. You can Google types of countertransference. You'll find quite a few, but I'm going to give a simple false dichotomy, but I think it's a helpful dichotomy. We need to differentiate between what is ours and unique to us, or is a majority of a reaction of something that has to do with our personal lives, versus a reaction that I describe to people as us being a barometer, that we are feeling and sensing something that a lot of people would likely sense from them. And to be a barometer, we've got to manage our own stuff. I'll give you an example of why this could be important. So let's say you have a family member in your past that used a bunch of substances of some kind and caused a lot of strife in the family. And that was somehow unresolved, and maybe you haven't really worked through it much. Say if you now meet with a client or patient in the present who has a similar substance use issue and add a cherry on top that seems to have a very similar personality or a similar life story as this family member. You as a provider, especially if you've not worked through this, you're going to have a hard time separating out what is a reaction based on your history versus a reaction that is legitimate and unique to this individual. There can and will be overlap, and there's nothing inherently wrong with that, but it messes with your objectivity. Doesn't mean you can't be objective, you just need to be extra diligent. And this extends even beyond if that person is your client or patient. This could be someone you're meeting with and they're talking about a relationship outside of the therapy room. And you could put your own issues into that process. Let's say if you are, still working through this challenge with this family member and you're like, I should have set boundaries way sooner. I gave them way too much slack. And now there's this person coming in going like, well, I don't want to push them too much. And then your countertransference, which might not come up if you had not had this experience, would be you need to set boundaries. You need to set them right now. Could that be an appropriate clinical intervention to a certain degree? Maybe. How much is it tinged by your experiences, your stuff that you're not managing? Could be quite a bit. And so we really have to be on top of this in any work that we're doing to differentiate between these two. Never mind you that contextual and demographic differences already create different perspectives, situatedness of me as a white male versus, somebody else in their own unique status. We're already navigating that. Never mind our own countertransference reactions. So if your therapeutic approach doesn't talk about this stuff, I encourage you to go looking around about what do you do with this, because it's foundational. I don't care if you're super transactional. It's something that you need to consider in the very least for diversity-related reasons. Relational psychodynamic people talk a lot about power and laterality and how to establish that, which you're welcome to go perusing around for our literature, but do consider this. This is especially important for personality disorders and especially for narcissism because, they love pressing buttons. They also know how to slide the knife right between the ribs. I mean, they are pros at this. Their valuing and devaluing it is brutal. On the valuing side, it's a little bit easier because it's easier to be in the valued position. However, it can have its cons too. Say if you have self-esteem issues or there's some sort of worries about your competence, to have somebody esteeming you can be a little bit of a challenge because it pulls the wool over your eyes because you're looking to be like, okay, this person really likes me. And if they like me, then I like them back. And when they say that they have these sorts of difficulties, maybe I should just validate them because they seem like a pretty good person. On the flip side, though, they also tend to be pretty good at saying, like, I value you, but I'm going to give you, this is not like a conscious direct thing usually. They give you lots of evidence. No, sometimes pretty consciously. This is where we go to the subtypes of the argument. But anyway, they can give you this sort of milieu of like, and you know how fickle that is? And you know how quickly I can devalue people? And it just gives this subtle kind of commentary of like, you're in my good graces and you better be careful because you could not be as well. And that can lead to a lot of hesitancy that if you're in the valued position that you don't want to thwart that you don't want to mess with your and it creates a reluctance to challenge them, which you have to be doing in this work, which we'll get to later. On the flip side, if you're devalued, it's not a fun position whatsoever. It is bad. It doesn't make you really want to do this work often. And it runs the gamut. On the one side, if you have low self-esteem, as we discussed, it can make you feel incredibly small and insignificant and doubting yourself, which is precisely what they want you to be feeling because it gives them a sense of power. You can even try to bargain for power, which is equally dangerous, because what you're trying to do is basically give them power by saying, I need your esteem. And they go, haha, now I'm in control of the esteem piece. Now, if you prove yourself and suddenly become a worthy adversary, they might switch you into the valued position, but that's not you begging for power. You're just being yourself, ideally. And when they have underestimated you, it's fascinating to watch them suddenly put you in the value category, because they realize it's too much of a threat to keep devaluing you. If they're like, oh shoot, this person has a backbone, or this person really has a spine and is challenging me on some things, so now I'm going to esteem them. Another reaction, though, is very legitimately frustration and dislike of these individuals. And that includes both when you're valued and when you're devalued. When you're valued, it can feel like insignificant or fake, like really fake. Like you see through it. You're like, I'm just an object to you. Like, what you're giving me praise, but it feels empty and hollow, and I don't like that. And then obviously, if you're in the devalued position, it's just like, screw you, man. You're an asshole. Like, what is your deal? And you have to manage that response, because on one hand, you could get so frustrated, you're just like, I'm not even going to listen. I'm barely going to be here and barely be present. Or number two, you can move into a more aggressive role. This is especially true, I think, as social justice ideologies enter the fray more. There is this pull to like tell them what's up and put them in their place, but you're not going to put them in their place. You're not going to come in and be like, I am more powerful and more knowledgeable, and they'll just succumb to this and be like, you're right. I'm so like, you're not going to win that. You're not going to win that with a narcissistic defense, especially not a staunch one. And so you need to be careful not becoming so small, but also not trying to puff your chest and try to engage in a power struggle with them, because neither one will be effective. It will ruin your effectiveness. And so what we talk about at the end of the day is you're trying to take a more objective stance, just kind of sitting there and trying to weather their storm, but reflect to them and still engage and challenge them, which is heading us into step 2. Or step 3, which is like, what are we actually doing here? A quick caveat, though, kind of going back to framing. You can go back to framing. Framing is not one and done. You can go back to it. And there is a difference between them being challenging and jerks and assholes to you and being overtly inappropriate and aggressive. You are very much allowed to go back and say, new ground rule here. You cannot stand up and posture. You can get angry and raise your voice, but you can't stand up and posture at me. You cannot tell me... you can't call me this derogatory term. That's not going to fly. So you are allowed to set some firm boundaries. Just understand there is this gray zone where like you need to be ready to withstand their storm, because they're not very kind. And you can feel entitled to be like, I don't want to work with you all day long. Well, don't do the personality work if you're not ready for that. But, or should I say and at the same time, you're allowed to have some firm boundaries. It's the same thing with borderline personality disorder. If you're familiar with that type of treatment, you are allowed to have a couple lines in the sand that don't cross, and really get an agreement from them. We're not going there. Like, we're allowed to have this exchange and it get a little bit messy, but not that far. So protect yourself. Be willing to protect yourself if it goes so far. So what exactly are we doing? Well, this whole objective approach, some people I think misunderstand that as like blank slate, old school psychoanalytic. I'm just going to be this blank slate that they're going to project on, and I'm just going to analyze them. It can be destructive. That's kind of a Kernbergian, I don't know if that's a word, a Kernberg sort of mentality, I think, whereas there's a more Kohut version. These are old school folks that really paved the way for treatment ideologies around narcissism, more highly empathic. And it's fun because they kind of argue with each other that neither one thinks that the other is helping. Meanwhile, relational psychodynamic folks, I think particularly, I'm so bad with names, I think Stephen Mitchell, threads the needle between the two, and I find that to be the most important, that you are relating with them, that you have to find a way to really be present with them and truly relate, and just, kind of weather these storms and be like, guess who's still here? I'm going to give you the type of relationship that terrifies you and you actually need. Not without its boundaries, right? Not without its frame. But you're going to be there genuinely trying to relate and understand them. Simultaneously, though, you're going to use countertransference and transference, and poke and prod and pick away at this narcissistic defense, chip away at this wall. And so holding this both end, I think, is really, really important, because you need to create a sufficient holding environment to sufficiently relate, even when they're being jerks. But at the same time, that doesn't make you small, and it doesn't make you shy away from conflict. This is not to say you overwhelm them with conflict. You can't just line up the catapults and start barraging this castle wall. They're going to wall up even more, and you're going to be ineffective. It's that chipping away process of like, I'm here to understand you, and I'm going to periodically reflect with you, which gets to how do we conceptualize this change? Well, it goes to my inaugural episode. The first episode I ever created was change over time. This idea of psychological change over time. In brief, you can go seek out the episode. In brief, it's all about grounding, observing, and acting. What people are inclined to do, and what a narcissistic defense wants you to do, is problem solve. Because remember, I have to be perfect to be okay. If I'm even willing to come into treatment, I'm at least admitting to some degree, unless I was absolutely forced to come in, that I have to work on something. So just give me the solution so I don't have to worry about this anymore. You'll notice it's not terribly like, I want to learn. It's more just like, give me the damn solution so I can feel perfect again, so I can feel okay again, and I can peace out. That's why if you're not paying attention, especially the more neurotic individuals, they'll come in for coaching or therapy or something like that. And you're like, oh yeah, you seem pretty smart, and yeah, I don't know about that, and here's a solution. They're like, sweet, see ya. And then they go out and they implement that. Maybe they get better for a moment or two, but fundamentally the defense remains, and they get in trouble again. And they'll either be back again, or they'll say that therapy's unsuccessful. I'm not going to do that crap again. So you cannot collude with their desire for answers, and they can invalidate you and devalue you if you don't give them answers. And you just have to be willing to weather that storm, and that's why that frame is really important. I'm from the get-go saying, like, I got to understand you, like the chapters of you, to understand what we're going to be doing in the present. Remembering this is synonymous with anybody, even beyond personality, so it works with everybody. But it lays the groundwork for this too. Like, you're going to tell me, and you can use examples from their life. You're going to tell me if I don't understand your situation, I can give you the solutions. That gives me a lot of authority. That's kind of interesting. And so you can kind of pull them in and say, and get them to agree, like, okay, you got to get to know them a little bit before you start giving them action items. The trick being, you're not going to give them action items terribly soon. Some of them, neurotic levels, you can kind of play with a little bit, but the lower organizational levels, you definitely aren't going to be giving them a bunch of solutions. So instead of action, you go to grounding and observation. Grounding and observation are terrifying to them. Absolutely terrifying to them. To ground and to be present with someone is highly uncomfortable, and to sit and observe and scrutinize one's behavior is just terrifying. It's absolutely terrifying to them, and they're going to avoid it at all costs. It's the whole purpose of the narcissistic defenses. You don't have to be with somebody. You don't have to evaluate yourself. You can just conveniently sort people based on value and devalue. If something is uncomfortable, you don't need to sit with that. And so to have them ground and you connect with them first is a really weird experience for them that they're not really going to appreciate, but is something that is necessary and needed. Even when they sling stones at you, okay, yeah, that's fine. Still trying to understand what's going on for you. But then you're very quickly treading into observational world where you reflect things to them. And those reflections aren't necessarily fun, and that's why you framed around it at the very beginning. It's not fun for them, maybe not fun for you either. But it could be anything. If you're in a valued position after hearing a few stories and stuff, you could say something hypothetically like, it's interesting, you seem really hell-bent on me understanding how good you are at this sort of thing, or how incompetent everybody around you is. That's interesting to me. Or if you're in the devalued position of, it seems really interesting to me how much you want to convince me how little I can help you. Help me understand where that's coming from. They will swat this stuff away and not really do much with it and get very frustrated at you as you offer these little reflections. But you're chipping away and hoping that they will start to recognize what is going on between the two of you is going to extrapolate and apply to the world around them. So people might be inclined to tackle the here and now outside of the therapeutic relationship or the past first. Neurotic level individuals can probably do this, but when you get to lower organizational levels, they have a really hard time tolerating that. And starting with the relationship can be highly effective to then begin to generalize. Because if you get one of them saying, there is this sort of pattern in my life, holy cow, you struck gold. Now you got to see if they're willing to authentically encounter that. It's not like a covert manipulation moment. But if they really start reckoning with there's a pattern, you're getting there. You're chipping away at the wall well, because you're letting them get into this position of discomfort to admit wrong. They'll still reflexively pull back and show the narcissistic defense, because they can't tolerate full I am in the wrong. If that happens, they will often deconstruct. I mean, you have to understand, narcissistic personality disorder is at risk for suicide, whether it's their defenses failing or it's a defense failing in the sense of helplessness, and or sometimes as a final show of look how you have misunderstood and mistreated me, boom, right? So they are not without their vulnerabilities. So you do want to be careful about chipping away at the wall. But when you get these little windows where they're like, maybe there is something going on, you can start moving them deeper into observation and maybe even into action. And action is super fun to get into with them too, especially if they're willing to get vulnerable enough, because it's almost like they're a kid again. And you're almost engaging in a reparenting experience. I don't think they'd like that term, but this idea of teaching and encouraging and having them test stuff out, things that they haven't tried before because the narcissistic defense disallowed them. That's pie in the sky stuff. You will often not quite get them there. There are times in which you are not doing insight work, and instead you're doing foundational kind of coping and stop doing destructive things work. So it really runs the gamut, but that's like the general gist here. You're symptom managing, grounding them around stuff, maybe getting them to observe, and if you're lucky, getting them to actual change in their life and instituting that change. So, it's an awkward process. It's a challenging process. That's the quick and dirty version of it. But you really have to be ready for it. The joke I kind of say is, imagine them on these massive castle walls, and they're up there all self-important, and how are you going to help me? And you come in, all low on the totem pole on the outside of these walls, saying I don't know, but these are the parameters of how we can help. You want to agree that? Yeah, sure. Okay, see you tomorrow. Come back tomorrow. Well, I just want to get to know you. I don't give a shit about getting it. You need to help me get better at this stuff. Yeah, but remember how we talked about I need to get to know you? Okay, fine. And then as you keep coming back, you're like, it's me again. I noticed this stone, and it looks like a lot of other stones in the wall. It doesn't seem like that's like a good call to be doing. Isn't that kind of weird how that's structured? I'm just going to take this stone out. Don't you dare take that stone out. Why? I'm just going to put it down here. And there's this really uncomfortable exchange where they're like, I need a better wall. And you're like, I'm going to deconstruct your wall a little bit. And it's just, in some ways it's fun. But the process itself can absolutely be not fun depending on how it goes. But that's kind of the gist. That's kind of how I see it. They trust you just enough to let you keep messing with the wall. And sometimes they don't like it. Sometimes they'll throw a stone at you like, all right, I'm going to put this down. All right, yeah, thanks for coming. I hate you. Okay, well, I'll see you next week. Not precisely that, but, the kind of gist there. You just have to have the right temperament for it, and that's where consultation is helpful too, because it guards against the wearing nature of that type of work. You get your foot in the door and you just start chipping, and you see how far you can take it, and you deal with ruptures as they come up. You return to the frame as necessary, and you keep chipping away at it. And if they exit treatment, then you did what you needed to do, because if you're not doing that, you're colluding with the defense and you're not actually helping them. So you have to take the risk of being fired, but there's intentionality in how you do it, and hopefully some food for thought today. So frame, manage transference and countertransference, funnel that and use it when you're intervening with them, rolling through grounding and the terror of observational work, with maybe some happy accidents and good luck getting into action, depending on organizational level. Again, neurotic folks tend to do a better job with that stuff. So getting to what would I do if someone came in and they have a loved one, a friend, a boss or something like that who could be employing a narcissistic defense? Good question. I'm going to keep it very brief, very bright. It might not answer all your questions, but I'm going to distill it into two things. One, your sense of self and esteem, and two, a willingness and a firmness in setting boundaries. What's really fun about this is it kind of models and mirrors what I just said about treatment providers. Not perfectly, remember you're not a treatment provider, but when we think about framing and we think about the management of transference and countertransference, they share some similarities. So the management of transference and countertransference, I kind of think of it through the lens of building self-esteem. A sense of yourself and a firm sense of yourself and values is really important to be able to frame things and set boundaries around a frame. I was kind of alluding to this with providers, and this is especially important, and my apologies if you feel called out or if you feel this is incorrect, but it's no coincidence that narcissistic individuals will sometimes find people who are overly giving or have their own self-esteem issues because it's easier for their defense to proliferate there than it is with someone with a firm sense of themselves. So building that sense of self is not just like, I'm going to do this for the service of this relationship. It needs to be for you. It's going to help you in all your relationships and all your contexts that you find yourself in. So building that sense of yourself, borrowing from areas that maybe you have a greater sense of self and esteem in, and really building in that. What are my values? What do I really want? Do I need to work with a therapist to explore through my past and these sort of misgivings or my own defenses that get in the way of being an equitable partner, to really be a force to be reckoned with, an equal, a rival in a relationship? What do I need to do to work on this? Because unless I have that, it's going to be very hard for me to say, these are my needs, this is the type of relationship I want, and I'm going to set boundaries around this sort of thing. Now, do understand the goal here is not to switch hands of power. Well, you were the one dictating the relationship. Now I will dictate the relationship. What you're trying to do, and what I'm trying to help people to do, is say, you're there to collaborate if they are willing to collaborate. This is what I want, need, and value. And if you're willing to have an open, legitimate conversation about that, yeah, I'll work with you, because that's healthy relationships. This is bi-directionality. But they often can't do that. And so then you have to be willing when they can't do it or they challenge it and they push it. And then you have to say, like, well, that's fine, but I'm not engaging in this. Like, this is not collaborative. This is not what I'm looking for. And setting that boundary is really important. Now, do note this is difficult work to do, especially without the other person in the room. That's why I refuse to diagnose people if I've not met them before. Could they have narcissistic tendencies? Yeah, they could have also other insecurities and other things that are causing this relational conflict. This is not unique to narcissistic personality disorder. But if something like this is going on, that sense of self and that firmness and the unwillingness to budge in that is a great litmus test for how much someone is really willing to be a partner with you and see you for a full human being with their own needs. It's a wonderful way that when you operate that and they can't meet it, all of a sudden a lot of folks that I meet with talking through these issues, they're like, I suddenly see the forest for the trees. They're not going to do this with me. So I either need to push for the change. This is where like couples work with them can come in handy. It's very specialized, challenging work to do. And or them getting into therapy themselves or whatever it is. Or the reality is sometimes you leave that relationship. It's not worth it to keep investing in. Now this is not me dictating the outcome. It's just kind of giving the permutations of when you have a firm sense of yourself and a firm sense of your boundaries, they're going to shape your relationships. I don't even care if it's just like a typical family discord. If you throw a wrench into a typical family dynamic, it's gonna go through some tumultuousness before it finds its way to a ideally healthier norm. Same thing goes in this circumstance. You start being firm, things are gonna shift, and then from that shift, you got to make possibly tough decisions of what do you do with that next, especially if the person or persons are not shifting with you. So I don't know if that's helpful, but that's the gist. Self-esteem and boundaries. Oversimplification, but it's central if I'm working with people on these issues. It's central to what I'm talking about with them. So hope that's helpful. Hope the treatment stuff from a provider lens is helpful too. Curiosity provoking as usual, gives you a little bit of things to consider. Think about whether you've worked with someone with narcissism before or not, or maybe you suspect that you are. So just keep considering it. Think about it more. Again, I've got other episodes here if you haven't watched them. Otherwise, I thank you for your time. Thank you for listening, and as always, stay curious.